Good evening, everyone. Today we will be discussing dementia counseling station. Um, in your NAC OSCE exams, you may come across a patient or family member who you have to give the bad news that they themselves or their family member is uh, diagnosed with dementia. Like every other station, in this station, the first thing would be to introduce yourself. Hi, I'm Dr. Fayaz. Hi, I'm Dr. A, Dr. B, Dr. Z, etc. And then ask if it's a good time to talk to them. Once you confirm that they're ready to hear the diagnosis, you can go ahead and let them know of the diagnosis in simpler words. You can also word the introduction like, "Hi, David. Thank you for bringing your father in. I understand how difficult it can be to watch someone you love change like this. I have reviewed what you shared, and I would like to go over my questions and how we can help from here." This way, you're introducing the patient to a likely diagnosis, and you're giving them a heads up that you're sharing your impressions or what's going on with their father or their family member whom they love, and you're also providing some reassurance, although it's not very direct. But if you look at this sentence, I understand how difficult it can be. It's very empathetic. Patient or family members specifically would really want to hear something like this. Now, once you introduce yourself, you're about to give them the diagnosis. Start with a few symptoms of what your working diagnosis is. For example, here we have, based on the memory loss, daily functioning decline, and changes in behavior you described, your father may be experiencing a form of dementia, most likely Alzheimer's disease, which is the most common type. Now, you're giving them a brief recap of the symptoms, which is memory loss, functioning decline, changes in behavior, and then you are giving them a likely diagnosis, which is Alzheimer's disease. And now, once you have given that, pause, see if they ask a question. If not, you can continue with the explanation on what dementia is. So here we have dementia is a gradual condition that affects memory, thinking, and behavior. It's not just normal aging, it causes real problems in day-to-day life. Now, here we are giving them real truth or how it's going to be. Dementia is a gradual condition, it's progressive, it affects their memory, their thinking, and their behavior. And it's different than normal aging. Sometimes some people may think, oh, dementia is like normal aging, but we are making sure patient's family knows that it's not normal aging. And we are giving them a heads up kind of to make sure that they know it causes real problems in day-to-day life, that dementia can cause problems with everyday life. You may have the patient's family or patient ask, is there a test to confirm? Um, Now, Alzheimer's disease and other dementias, we do some testing to rule out organic causes. Once those are ruled out, then we can say it's Alzheimer's disease. And here they want you to explain to the patient or family member what investigations we can do. So the answer to the question, is there a test to confirm this? You can respond with something similar to yes. We will be doing blood work to rule out reversible causes like thyroid problems, vitamin B12 deficiency, or infections. We will also get a CT or MRI scan of the brain to look for strokes, tumors, or other conditions that might explain his symptoms. In this one brief sentence, you can see that we have explained to patient's family member what we are going to do or what our working plan would be. We are going to do blood work to check for thyroid, hypothyroidism, vitamin B12 deficiency, infections. We will get a CT scan or MRI or neuroimaging in general to look for secondary causes of dementia like strokes, tumors, other abnormalities. Now, after that, you can add this sentence to the investigation. We will also do a memory test like the MOCA or Montreal Cognitive Assessment. which helps us understand how much his thinking is affected. Mocha is really good in determining if someone's forgetfulness or issues in recalling details is um, related to normal aging, or if it is more of a dementia or memory loss. Mocha checks all dimensions of or all domains of memory loss that happens in Alzheimer's or dementias. Now, once you give the explanation about what the diagnosis is, what tests we are going to do, thyroid, B12, infection, CT, MRI, and then MOCA, you may get a question like, so is there a cure? Or if the patient's family may want to know if there is any cure. If they don't, let them process the news, give them a few seconds before explaining anything further. If they ask you a question, answer accordingly. Now, if they say, is there a cure? So the next thing would be to discuss treatment management with the patient. We know that there is no cure for dementia, unfortunately. Once patient starts developing symptoms, they progress over time. But there are some medications and some uh, structured activities that can help in slowing down the progression of symptoms. Most commonly, we start with donepezil. Donepezil helps in cognitive symptoms of dementia or Alzheimer's. So you can state that like this: while there is no cure for dementia, this one sentence is going to give the patient what they need to know, or the family what they need to know. There is no cure. They are looking for a cure, right? Now, once we give a bad news or something straightforward like this, you have to follow it up with something reassuring or hope providing. There are medications like donepezil that can help slow the progression of symptoms. Once we say this sentence, family member knows their loved one is going to get worse over time, but there are medications to help with their symptoms. You can add another sentence to it: treatment goes beyond medication, or you can say it in any other way that you prefer. You can say there are also some other treatment options other than medications. They include ensuring safety at home. Patient is not supposed to drive. We must fall proof the house. Daily activities and structuring routines are great in maintaining cognitive or cognition. Caregiver support for them or for the family member, not for the patient. And you can state it like this: we will also connect you with the community resources like the Alzheimer's Society and home care nursing, who can provide more help. Now, if patient's family says he already needs help with something or activity of daily life, like here we have the example of bathing sometimes, I don't know how long I can do this alone. Now, if they show any sign of distress, or if they don't show any sign of distress but you think they may be distressed, you can ask them directly, how are you coping, or how hard is it on yourself? Any sentence like that to make sure the caregiver is not stressed out, because caregiver stress is one of the risk factors for elder abuse. Now, here we have the example of, I don't know how long I can do this alone. Now, in response, you can say something like what we have here. That's very important to talk about. Now we are acknowledging this patient stressor for the caregiver. Caring for someone with dementia can be exhausting. We are making sure that they know we understand what they're going through, and you need support too. This is reassuring for the caregiver. We can refer you to respite services, caregiver groups, or social works to help ease your burden. These are different services that can help caregivers or patients uh, in different aspects so that the burden on the caregiver is low. Social work, respite, caregiver groups, etc. They may say that would really help, or they may say, no, I'm not interested, etc. However, then you can proceed based on that. Now, once we have addressed, we have given the diagnosis, the investigation, talked about investigations, treatment, management, caregiver stress. Next step would be to discuss safety and future planning with the patient's family member. You can uh, sentences like this. We also need to think about your loved ones or your father or your brother or your uncle's safety. For that reason, we would want to have the following things in place. Wandering risk. Patients with dementia may wander around, they can get into accidents, they can fall off a high place or have any fractures or anything like that. So for that, we can use medical alert bracelets to find out where they are, or GPS devices. For falls, remove rugs, have good lighting in the house. Should be the house, especially the shower area, should have grab bars in case they lose their balance so that they can grab onto it. Medications, caregiver is supposed, or someone that is support worker for the patient or a nurse, they would manage the medication since patients with dementia may not be able to do that by themselves. And finally, we need to discuss about patients' future in case they're unable to participate. Now, advanced care planning, or what should be done in case the patient is incapable of making the decision. This is very important to discuss with almost all patients who are terminal or whose condition is chronic and progressive, and we think that they may get into a situation where they're unable to verbalize or state their wishes clearly. We can also discuss it with routinely with our own patients that we think may need it. Family members may say, yes, he has advanced care planning, or no, we haven't talked about it, or we haven't discussed it yet. Here we haven't discussed talked about that at all. Now, in this case, you can tell them why advanced care planning is important. For example, sometimes we can run into an emergency situation where doctors may not know whether to continue with CPR or defibrillation, etc. If we have an advanced care in place and which is up to date, this will guide our treatment plan or decisions. Family members may uh, agree or disagree, then that depends on situation. You can then proceed how it goes. Once again, no pushing. Don't push it onto the family members. They're already stressed out by the diagnosis of dementia or Alzheimer's. Just discuss it with them. If they decline it, tell them that's fine, it's your choice, and we will come back to it sometime later when you are ready to talk about it. That's all that you need to do, and then chart it or document it in the chart. Now, once you have discussed family and advanced safety and advanced care, summarize your findings or summarize what is going to be done for the patient. Um, Here we have this statement. You can use something similar. So in summary, your father likely has dementia. We will confirm that with some blood tests and a brain scan, and we will start working on a care plan. We will involve a memory clinic, community supports, and a social worker for you. Now, this summary is very important in counseling stations. They want you to summarize to patients. You can do it once, you can do it a few times during the visit. Once is enough, a few times is better, but don't overdo it. Just summarize important points. You can do it halfway through and then at the end again, or you can do just one summary at the end. You will confirm, like here we have, you will confirm with blood test and imaging, etc., and work on a care plan. Now, once you have done that, uh, you have to give credit, or you have to let the caregiver know that they have done the right thing, so that they don't get discouraged or uh, they don't lose their motivation to keep caring for their family member. You're doing the right thing by bringing him in. Do you have any other concerns right now? Now, this will open up uh, a new conversation too, and it will help us in understanding what a family member is concerned about. Once we know what they are concerned about, we can adjust our management plan based on that. All right, and you may hear them say, no, I just needed to hear that we are on the right path, or they may say, yes, I am concerned about his safety, or I'm concerned how I'm going to cope, etc. And then you will address their concerns on how they say it. You can address it, whatever concerns they have. Make sure you're showing them empathy, you're showing them support, you're letting them know that they're not alone, and there are services to help them with all uh, aspects of patient care. Okay, this is all we have for dementia counseling.